Why do some hair transplants age badly? And I'm sure this has been a question on a lot of patients' mind, and it also happened to a lot of the surgeons. Some hair transplants can look incredible in the first 12, 18, 24 months, and then look inappropriate or even terrible, I would say, 10 to 20 years later. And this is one of the biggest problems that we're still facing today in modern hair restoration, because a lot of the times patients are being shown just the immediate transformation, and few discuss actually what happens many years afterwards. Today I would like to explain exactly why some hair transplants age beautifully while others slowly become unnatural, depleted, increasingly difficult to repair, and just age inappropriate. One of the most important concepts in modern hair restoration surgery is something that um, a lot of clinics rarely discuss or try to avoid, which is that hair transplantation is not a one-year decision. It's not a quick fix. It is often a 10, 20, 30 years commitment. And if surgery is designed without this long-term planning, then probably, most likely, problems usually will appear later. First problem would be an aggressive low-placed hairline. This remains a very big issue. A very low, let's say flat, youthful hairline may look impressively immediately after surgery and in the first few years, and especially on social media. But let's not forget, hair loss continues, and we've covered this in previous talks. The face ages, facial proportions evolve. There is this skin sagging, depletion of facial fat, all sorts of changes. What looks dramatic at 25 will look extremely unnatural at the age of 40 or 50. The biggest problem being that lower hairlines require an enormous number of grafts, and those grafts need to come from somewhere. And where do they come from? They come from a finite donor area supply. So patients unknowingly sacrifice future donor area reserve simply just to create this aggressively low-placed hairline. Isolated frontal islands. This is one of the classic signs of a poorly designed and poorly aging hair transplant, having this isolated frontal island. This happens when transplanted hairline survives, but the native hair behind it progressively disappears, and the patient is left with a dense frontal wall, a large empty area behind it, and I would say a major imbalance across the scalp. Unfortunately, that will become increasingly difficult to correct years later. Not impossible, but difficult, particularly if donor area reserve has already been heavily used. Another major issue, of course, is donor area overharvesting and depletion. The donor area is not unlimited, so every extraction matters. I cannot emphasize this enough. Unfortunately, I see patients that have underwent very aggressive extraction patterns early in life without understanding the long-term consequences. Initially, everything may appear acceptable, but after years of additional thinning, the donor area will begin to look visibly patchy, thin, scarred, depleted, and this is where repair surgery becomes extremely complex and in some cases impossible to perform. Unnatural density and design would be another important aspect. Density itself can also age poorly. Many patients assume that more density will always mean a better result. That is not the case. An extremely dense, harsh hairline will look artificial and will become even more obvious with age, particularly if the surrounding hair or the hair right behind it will start thinning. Natural hairlines usually soften gradually. They contain irregularities. They evolve naturally with one's face. Overly aggressive density right at the hairline eventually will create a very unnatural contrast, and this is again very difficult to correct. Big reason that patients misunderstand hair transplantation today, and a lot of other surgeries for that matter, is of course social media. Most online results will show the 6 months, 9 months, 12, 18 months progression. but very few will discuss how that result will look in 5, 10, 20 years' time. The need for second procedures, repair work, donor area exhaustion. This will create an unrealistic patient expectation because a hair transplant should not be judged only by how it looks 1 or 2 years down the line. The real question is, how will this look a decade later? In my opinion, the best hair transplant is for sure not the most aggressive one, but the one that will remain believable over time. This will quite often require restraint from the patient and from the surgeon's part as well. Sometimes using fewer grafts, planning ahead for the future, sometimes accepting a more mature hairline with a slight recession, sometimes protecting donor area reserve instead of exhausting them early on. Because great surgery is again not about creating the lowest possible hairline, it's about creating one that will look sustainable. A hair transplant should always age with the patient. It should not fight against aging. That will inevitably happen no matter what we do. And the surgeons who think long term usually will create the most natural result that the patient will be content and happy with years later. If you enjoy these educational discussions along the topics of long-term planning and ethical hair restoration, feel free to subscribe and watch for future videos. Motto of today's video being that the true quality of a hair transplant should not be judged after 1 year. I would say it needs to be judged in 5 and 10 years time as well.